So now we're going to do a lunge with a side bend using resistance. And this will help with lengthening the quadratus lumborum, the lower back. And it'll help with lengthening the psoas, which is probably tight, with tight hip flexion. And then also opening up this part of the respiratory diaphragm, ribs. And then this will help with, the side bend will help with the quadratus lumborum. So it's getting at multiple things. So to look at it from the front, we're going to come down on one knee and come up forward, and my ankle is underneath my knee. And then we're going to do a side bend, reaching up, and then I'm going to do a side bend here, but I'm not going to just collapse in. It's not just a stretch for here, but I'm going to do it with resistance, as if like I'm having to work hard on this side, so that I'm doing a kind of an isometric, right? So it's a big stretch on this side, and I'm working in resistance here. And we can just hang out there for a few breaths. And we can move forward if we want a deeper stretch in the front of the thigh, which would give us more stretch on the psoas, which again, as one of the hip flexors, that would be like an important thing to be able to do to help balance out the posterior pelvis. Mm-hmm. Okay, I'm going to come out of it. I'm going to switch sides, and then I'll do the side view. If we can move that. I find it helpful to have something under my knee, so that my knee doesn't get in pain. So let's see. All right, so I'm going to come forward enough to get a big stretch here. Hard to see. So come forward here, get a nice big stretch here, and then I'm going to reach over and do a side bend here, long stretch here, and then on the side that's bending is like there's resistance there. So I'm like working it from both sides of my body. And again, that's helping with stretching out my lower back, stretching out this front thigh, and it's also helping lift and open here. So this is getting at several things. The one thing that we don't want to do is we don't want to pop our ribs up, but just keep my ribs relaxed and down. And then you can add a little bit for your shoulder rotation by having the hand flare out and bringing that back, bringing the shoulder back, rather than having it like this. Mm-hmm. So then that'll help with getting some more external rotation going in the shoulder. Okay, thanks.